One night, I was getting ready for bed and I got an earache. The next morning, I got up, I had a slight headache. But I thought it would go away, so I got ready to take my walk. But the headache got worse and worse. And finally, I started to vomit. And I knew something was wrong. It was so intense that I couldn't even stand up.
And she was sitting in that chair and she kind of said, I got a headache, it's kind of bad. I'm thinking COVID. I said, we probably ought to go to the doctor.
I don't remember getting to the hospital.
It was very scary, and I'm thinking, the worst. Here's a healthy woman that has never had a problem, and all of a sudden, we're at the apex of something happening, and it's pretty serious.
I stayed in the hospital almost a week. Before I left the hospital, my hearing started to deteriorate. And after I was home for about 10 days, it was gone. It disappeared completely. What time will the game start?
Her hearing completely went away. She woke up and she said, I can't hear it all.
My husband called the doctors. They said they thought maybe the meningitis was coming back, so they told him to bring me back to the emergency room. When I got there, they did CAT scans and other tests, and no, you don't have meningitis anymore, but we'll send you to an ENT to check your ears to see what's going on. And he ran tests, did a hearing test, and he said, you are profoundly deaf. And the only thing that can help you would be a cochlear implant.
She came to our clinic at the ACC.
That weekend.
When I saw her husband was in the room.
And she could barely hear out of the right.
He has been supportive, very supportive, and he also acted as her translator.
Mainly she had earaches.
Just a few weeks prior to that, she had been hearing. So we had a conversation with speech to text on the phone because that was the only way we could communicate. Any headaches, she was very scared. She didn't know what was happening to her. She was suddenly in this silent world.
Do you understand me, Mr. James? Can you ask Miss Lynette if she understood me?
We know that meningitis can cause hearing loss. The inside of the inner ear is hollow. The fluid connects to the brain fluid. And so any infection in the ear can actually go into the brain. And so as ENT surgeons, we are very aware that any ear infection can reach the brain. And so my first question was, did she get meningitis because of something that happened in the ear? From the way she presented, it did appear to me clinically that there was something going on and the ear was in some way responsible for her having the meningitis. From the patient's perspective, living in a silent world is just terrifying, especially when you've heard until just yesterday. And this is the right side. They came to me for treatment of the hearing loss. The brain, and then hearing about all the other things was, I'm sure, very, very challenging for them. So they came to us for one thing, but had to be treated for another thing. Once we had that diagnosis, we contacted the neurosurgeons and we formulated a plan of what we needed to do.
And Dr. Mankakar had thought that she was a candidate for a cochlear implant, which would allow her to have some hearing, even despite the deafness. And so she was sent to me with the intention that we'd have to do a few surgeries for her. And the first surgery that we planned was to do a cochlear implant and to repair the leak on one side of her head and then go back and do the other side.
I was seeing her for cochlear implant evaluation. The cochlear implant evaluation is a process where we put hearing aids on a patient and evaluate how well they do with amplification.
Based on your hearing test,
Miss Lynette didn't do very good at all, even with hearing aids.
okay,
I think she was 0% understanding even with traditional amplification.
implant.
She was a candidate for a cochlear implant.
The primary aim of surgery was to prevent the CSF or brain fluid leaking and causing her any further episodes of meningitis. And the secondary aim was to restore hearing. So when we went in, we expected to see a defect, yes, but we didn't expect to see that extensive brain tissue in the ear, significant inflammation. So that was very unexpected. And it was difficult to get past it, to look into the ear to find the area where we could put in the stent and at the same time repair that defect. After the first surgery, we explained the difficulties that we had and why we had taken so long with the surgery and what we were attempting to do.
The surgery that should have taken about 4 hours ended up being between 10 and 12 hours.
So going through your mind, you're wondering, is everything all right? I was getting a little nervous because it lasted so long. So I just had to hold on, pray, and hope that everything was going good and trust the surgeons.
So we let her recover from that. 6 weeks to 2 months later, we did the second repair. She had really large defects in the base of her skull, and she actually had one that went directly into her middle ear cavity where, her facial nerve got a little bit irritated during our surgery. But in terms of getting the leak healed, the leak was able to be stopped, immediately post-op.
Anytime you do any surgery in that region, there is always the possibility that the seventh nerve, which is the primary nerve that causes the blink reflex, can be involved. She ended up having difficulty blinking and closing her eye after the surgery, and that's when we got involved. She had a poor blink reflex. She could close the eye partially when she forced it closed, but not all the way. She couldn't blink. The eye would get dry.
How is your vision?
And the blink is absolutely necessary to keep the eye moist. When the eye gets dried, there can lead to other complications. For instance, it could lead to a corneal ulcer, which could lead to a perforation and even possibly a loss of the eye if things aren't taken care of. If we were not able to keep it moist enough, then we're going to have to go to something called a lid load, possibly sew the eyelids together temporarily or even permanently in some cases. We decided to increase the amount of topical medications that we'd put in, something for the dryness. So we increased her to eye drops every hour, and we increased ointment to the eye, particularly at bedtime, and even taping the eye closed to try to offer more coverage for the eye during the night.
Very good.
They were very pleased that we were not going to have to do any procedures. And I think the fact that her vision continued to slowly improve was a good sign for both of them that she was going to do well. Miss Moye's husband was really a godsend. He is, I think, the primary reason that she did so well in her recovery as far as the application of the drops and the ointment. He insisted, I'm sure, that she take it as directed, and I'm sure he did a very good job of it because over time, we could tell the progress and that the cornea was not as dry as it had been and it was recovering.
Once she recovered from the second surgery, the discussion I had with both Lynette and her husband was that we will give enough time for her to recover from that surgery. We'll repeat the imaging and see if the cochlea is still patent for us to put in the implant, and then we'll go forward.
So I was involved in the third one when they placed the cochlear implant. And that one was a straightforward general anesthesia. For this one, we proceeded with a neuromuscular blocker, and we placed the breathing tube, we call it an endotracheal tube and make sure that the patient is quiet and doesn't move suddenly during the surgery so that the surgeon will have a perfect field to do the work that they need to do.
During surgery, we went in with the full knowledge that we might encounter difficulties and challenges, and we did. So the cochlea had started to get scarred. It was difficult for us to get the implant in. Typically, we can get in full insertion of all the electrodes, but in this case, we were only able to get partial insertion because of the scar tissue. And there was a long conversation with her as well as with James that we couldn't predict the hearing that she would gain after the implant.
She was ultimately implanted in October of 2021, and then a month later, roughly, is when the external processor is turned on. I saw her again, and we activated it and gave her sound again.
Miss Moye,
Yes.
can you hear me?
Yes.
We actually hear with our brain. And so what the electrodes of the implant are doing are they're stimulating the nerves in the inner ear. But the brain has to interpret that stimulus sound as words. That rehabilitation is very individualized. Some patients can do it very quickly and some just take a lot of time.
At her 1 month post-activation appointment, Miss Lynette's understanding was 6%. She went from 0 hearing to December of 2021. Her hearing was in the normal to mild range, and her understanding was already 6%. So that was very positive.
Do you need me to help you do anything?
No, I think I got it.
It was amazing because I think it was more amazing for him not being heard for a year than it was for me not being able to hear for a year. But it was amazing to be able to hear anything or to have a conversation.
We still talk. The thing is, she can turn me off at any time. She'll pull it out.
They were just the sweetest, strongest people. She went through a lot with all the surgeries. And I know it was disappointing after the first one that they couldn't do the cochlear implant, and then definitely disappointing when she got the facial weakness after the second surgery that we did. Through all of it, she just kept high hopes, high spirits, and suffered every punch like with a smile and rolled with it.
A training institute like Ochsner LSU is providing care 24/7, helping patients recover through these very complex issues.
It makes me feel good to be part of a great team because, nobody did it by themselves. It's a group of individuals and, of course, the patient and the family themselves. So it makes me feel great as part of a great team.
Let's go ahead and connect the processor.
Thank you for putting in the time and the energy and the creativity to get me to where I am.
When you hear sounds coming from this speaker, I'd like for you to press that button for me, okay? Even if they're very soft.
If it hadn't been for their creativity, I might not have been here. 2 times in 2 months, I was close to the end.
I remember the first surgery. My wife, of course, could not hear. She was laying on the ground in the room. They had given us a room before the surgery. Dr. Mankikar came in, and my wife looked at Dr. Mankikar, and she said, "Dr. Mankikar, I don't want to die." Dr. Mankikar took her hand and said, "Baby, you're not gonna die. We're gonna take care of you." That's the kind of caring that we had. We were just thankful that they did a great job.